What is schizophrenia? Let's delve into this question. Schizophrenia is a severe mental disorder that disrupts the way an individual thinks, feels, and behaves. This complex condition can make it seem as if someone has lost touch with reality, creating a world that is distorted by hallucinations and delusions. This can lead to significant distress not only for the person experiencing it, but also for those around them. The impact of schizophrenia extends beyond the individual, affecting families, communities, and society as a whole. It's important to remember that schizophrenia doesn't define a person, it's just one aspect of their life. So, as we embark on this journey to explore schizophrenia, we will strive to understand it from multiple perspectives. By examining its causes, recognizing its symptoms, and exploring available treatments, we can demystify this condition and promote empathy and understanding. Understanding schizophrenia requires a look into its causes, symptoms, and treatments. What causes schizophrenia? That's a question many of us have asked, and the answer, quite frankly, is not straightforward. Schizophrenia is a complex disorder with a range of factors contributing to its onset. While we don't have a definitive answer yet, we do have some strong leads. One of those leads points to genetics. Yes, schizophrenia can run in families. However, it's important to note that just because someone in your family has schizophrenia, it doesn't guarantee you'll develop the disorder. It merely increases your risk. Another factor that can contribute to the development of schizophrenia is the environment. Certain environmental factors such as prenatal exposure to a viral infection, early childhood trauma, or high levels of stress may trigger schizophrenia in people who are genetically predisposed to the disorder, but again, it's not a guarantee. Many individuals exposed to these factors never develop schizophrenia. Then we have changes in brain chemistry and structure. Researchers have found that people with schizophrenia often have an imbalance of certain brain chemicals like dopamine and glutamate, which play a key role in transmitting messages in the brain. Moreover, studies have shown that people with schizophrenia may have subtle differences in brain structures. For instance, some may have slightly larger ventricles, the spaces within the brain filled with cerebrospinal fluid. Yet, as much as these factors provide us some understanding, they don't paint the whole picture. There's no single schizophrenia gene or universally triggering environmental factor, and not everyone with altered brain chemistry or structure develops the disorder. What we know is that it's usually a combination of these factors, genetics, environment, and brain chemistry, that leads to the onset of schizophrenia. In the end, schizophrenia is not caused by any one thing we can pinpoint. It's a complex interplay of many factors, much like a puzzle with numerous pieces. As we continue to research and understand more about this disorder, we hope to put more of these puzzle pieces into place. Despite ongoing research, the exact cause of schizophrenia remains a mystery. What are the symptoms of schizophrenia? When it comes to schizophrenia, the symptoms can be as varied as the individuals who experience them. However, they can generally be grouped into three main categories: positive symptoms, negative symptoms, and cognitive symptoms. Firstly, let's talk about positive symptoms. Now, don't let the term positive confuse you. It doesn't mean these symptoms are good. Rather, it refers to symptoms that are added to the person's experience. These include hallucinations, such as hearing voices or seeing things that aren't there, and delusions, which are firmly held beliefs that aren't based in reality. A person might believe they're being watched, that they have special powers, or that their thoughts are being controlled. These symptoms can be incredibly real and frightening to the person experiencing them. Next, we have negative symptoms. These are aspects that are taken away from the person's normal functioning. They may include apathy, lack of emotion, and social withdrawal. A person with these symptoms might find it hard to feel happy or sad, may lose interest in activities they once enjoyed, or may isolate themselves from others. It's important to remember that these symptoms aren't a choice or a sign of laziness. They're a part of the illness. Finally, there are cognitive symptoms. These can affect a person's ability to think and process information. They may have trouble with memory and concentration, struggle to make decisions, or find it hard to understand information and use it in a meaningful way. These symptoms can make everyday tasks, like working or studying, significantly more challenging. One key thing to remember is that the severity and combination of these symptoms can vary greatly from person to person. Some might have more severe positive symptoms with few negative symptoms. Others might primarily struggle with cognitive symptoms. There's no one-size-fits-all presentation of schizophrenia. These symptoms can be distressing and disabling, affecting all aspects of a person's life. But with the right treatment and support, people with schizophrenia can lead fulfilling and meaningful lives. We'll talk more about that in the next section. How is schizophrenia treated? Now that's a question that resonates with many. While there is no definitive cure for schizophrenia, it can be managed effectively with the right treatment and support. It's a bit like learning to sail in stormy seas. The waves may be unpredictable, but with the right tools and guidance, you can navigate through. The cornerstone of managing schizophrenia lies in the use of antipsychotic medications. These drugs don't cure schizophrenia, but they can help manage its symptoms by affecting the brain's neurotransmitters, specifically dopamine and serotonin. It's important to remember that everyone is unique, and the same medication may not work for two different individuals. Therefore, it's a process of trial and error under the watchful eye of a healthcare professional to find the right medication and dosage. In addition to medication, psychosocial treatments play a critical role. These treatments help patients deal with everyday challenges, from managing their symptoms to communicating effectively, making informed decisions, and maintaining healthy relationships. Cognitive behavioral therapy, or CBT for instance, can help patients understand and change thought patterns that lead to troublesome feelings, thoughts, or behavior. On the other hand, social skills training focuses on improving communication and social interactions, while vocational rehabilitation and supported employment can help in managing career-related challenges. Another key aspect of treatment is coordinated specialty care, or CSC. This is a team approach to treating schizophrenia when the first symptoms appear. It combines medication, psychosocial therapies, case management, family involvement, and supported education and employment services, all aimed at reducing symptoms and improving quality of life. The importance of early intervention cannot be overstated. Like catching a train before it speeds away, early diagnosis and treatment can significantly improve the long-term outcome for people with schizophrenia. The sooner the treatment starts, the better the chance of managing symptoms effectively and leading a life that's not defined by the condition. And then there's the role of continuous, comprehensive care. Managing schizophrenia is not a sprint, but a marathon. It requires long-term commitment, patience, and an understanding that there will be ups and downs. Regular checkups, medication adjustments, and ongoing psychosocial support are all part of the journey. It's also crucial to remember the role of a strong support network. Family, friends, or support groups can provide the emotional backbone that's often needed. They can help in recognizing early symptoms, ensuring medication is taken, and providing encouragement and understanding during difficult times. To put it all together, medication, psychosocial treatments, early intervention, continuous care, and a strong support network, these are the key elements in the treatment of schizophrenia. It's a comprehensive approach that looks beyond just managing symptoms, focusing instead on improving the overall quality of life. With the right treatment plan, people with schizophrenia can lead fulfilling and meaningful lives. The journey may not always be easy, but with the right tools and support, it's a journey that can be navigated successfully. We've covered a lot today, so let's summarize. We've embarked on a journey to understand schizophrenia, a medical condition often shrouded in misconceptions and stigma. We've learned that schizophrenia is a chronic mental health disorder characterized by disruptions in thought processes, perceptions, emotional responsiveness, and social interactions. It's a complex and multifaceted disorder, with no single cause but rather a combination of genetic, environmental, and psychological factors that contribute to its onset. We've delved into the possible triggers for schizophrenia, highlighting factors like genetic predisposition, chemical imbalances in the brain, and certain environmental influences. But remember, these are just potential causes. The field of mental health is continually evolving, and our understanding of schizophrenia is no exception. Next, we explored the symptoms of this disorder. We learned that they can be categorized into positive symptoms, those that add to a person's experience, like hallucinations and delusions, and negative symptoms, those that subtract from it, such as apathy or lack of motivation. It's important to note that these symptoms can vary greatly from person to person, both in severity and in the combination in which they appear. Then we discussed the treatments available for schizophrenia. We underscored that while there is currently no cure, there are numerous ways to manage the condition effectively. These include antipsychotic medications, psychotherapy, and social and vocational training. We emphasize that a comprehensive, individualized treatment plan is key to managing this disorder. In essence, we've learned that schizophrenia is a complex, multifactorial disorder. It's not simply a matter of snapping out of it or pulling oneself together. It requires understanding, medical intervention, and support. Remember, schizophrenia is not a life sentence. With understanding, treatment, and support, individuals with schizophrenia can lead productive and fulfilling lives. So let's continue to expand our understanding, eliminate the stigma, and support those around us, because with knowledge comes power, and with power comes the ability to change lives.